Your lower back in here, yeah? That
Yeah.
you felt, yeah?
Mm.
And it was bothering you at Run Club the other day as well, right?
Mm. I feel pain every time here.
Yeah. Where exactly?
Here.
Yeah. Would you say it's maybe the left side, the right side more, or it's hard to tell? Kind of in the middle?
It's near the right.
The right side,
Yeah, yeah, the right.
And what about your hamstring injury? Is that the right or the left?
Right.
How long have you had hamstring problems for?
Like now, I think 4 days, like 5.
4 or 5 days, yeah?
Yeah.
So we wanted to see if your hands can come and touch the floor or how far you're getting down, yeah?
Mm-hmm.
Okay, let's go. Reach down, this way. That's it. Good. And stop when you start to feel, yeah? Here?
Mm.
And where exactly does it hurt? Here, right?
Yeah. Ah, my God.
Okay.
Ah.
It's hurting.
Oh shit. Oh shit.
Slowly, slowly come up.
Mm.
Out of 10, how much pain would you say that is? Out of 10, when you come down at the bottom.
See, when I come down, it's become like 5, 6.
Yeah.
But when I go more, it's become full.
More, like 10 out of 10.
Yeah, 10 of 10,
Yeah,
exactly. 10 of 10.
When was the last time that you think you was able to actually touch the floor like completely?
Completely, like, especially if I go to make some stretching, you know,
Yeah,
if I
yeah.
make some fitness things.
Mm.
I feel pain, but a bit. But
Mm.
because today I didn't do nothing, so that's why I feel more pain.
That's unbelievable, yeah.
Mm.
You're a sprinter, right?
Exactly.
And is the lower back something that you have trained specifically, like in the gym, for example?
Mm.
Have you ever done like you see this machine sort of? Have you used this one before? Or you've never used this one?
Sometimes maybe, but not.
Sometimes, yeah.
Sometimes I use it.
But
sometimes
not so regularly.
Mm-hmm.
Okay. In here, yeah?
Yeah. Oh my God. Ah, shit. Ah, damn. Oh my God. Ah. That's it, man. Ah, my God. Oh.
So we're currently working on him with his t-shirt on because this actually allows us to identify where the muscle knots are a lot easier because there's less friction. So there's more friction here, meaning that we can actually, when we find an area, not slip off of it very easily. So I often find it better to work on clients starting off with the t-shirt on for that reason, so that we can locate all of those knots. Deep breaths. Deep breaths. If we don't regulate our breathing and make sure we're breathing in all the way and then out, what will happen is that your nervous system won't relax and therefore your muscles won't relax. We need to release this muscle called the erector spinae here and the fascia that is here in the lower back as well, so that we can start to move and feel better. Yeah? Deep breath in and out. Deep breath in and out. Feeling a deep stretch in here, yeah? Hip flexor, good. Your running coach, he was saying that your back curves more, like this when you're running. That's called anterior pelvic tilt and lordosis. Because the muscles here at the front, what we was just looking at, the hip flexors, yeah? If they get overly tight, then they pull your pelvis down like this. Yeah, these muscles here, they get tight, they pull the pelvis down. And then, of course, if you're running, with the impact, the facet joints here at the back, you see how they're more compressed now? Then the facet joints here have to take more pressure, and then that sends the erectors and the muscles back here that you said that you felt into like a state of shock. Perfect. I need deep breath in. And deep breath in. And out. Good. Push up a little bit. Push. Push up, push up, push up. Up, 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 up. And relax. Good. Push up. And relax. Good. Push up as if you're going to bring your foot to the ceiling, yeah? Push up. Good. And relax. Good. Let go. That's it. 5, 4, 3, 2, 1. Relax. So the hips are really, really tight. We want to be, so this will be 0 degrees, and we want to at least be getting 45 in internal, which we're getting here. By external, we want the same. And you can see it's really limited here. Good. Relax. Now relax. Good. Push. Relax. Push. Relax. Abdominals down as well. Crunch, crunch, keep it tight here. Good. Rotate. Good. You okay, bro? Keep everything here, yeah? Okay. Perfect. Deep breath in. Okay, keep everything tight here, yeah? Tight, tight, tight. Head up like this. Perfect. Deep breath in. Perfect, brother. Keep everything up here, yeah? You're okay, don't worry. Deep breath in. And out. That's it, perfect. Out.
Damn.
That's the one right there. You heard that?
Yeah. I think me and the rest of the world heard that.
Perfect. You okay? Drop your hands into my head here. Drop. That's okay. Drop your head into my hands, sorry. That's it. That's it. Good. Good job. Okay, stretching the back. Good. Drop the head. Drop. Just this one. Right side. There we go. Good. Breathing. Relax. You good, bro?
Daisy.
What?
No, right?
Daisy, Daisy?
Yeah, that's what you were singing when you was rocking his head.
Was I, yeah?
Yeah.
Oh, okay. What?
No.
So what we're doing now is we're working into those erector muscles in their flex state. This is more of a superficial technique that is hitting the fascia. We have a big band of fascia that joins here from the lats, from the erectors, and this can get extremely tight and dehydrated. So if we slowly work into this area in what he is limited, which is his flexion, then as we release these muscles, then we can actually take him into more and more and more flexion. If I was to do this with him, you saw his flexion when we started, then what would have happened is that we would have got a pain response here. But now that we have mobilized the entire area, we've opened up the hips so that he can come into a good amount of adduction here. The reason that this technique is so effective for those with anterior pelvic tilt is because they are constantly stuck in the opposite direction. So when we are able to relax these muscles and bring them into a deep flexion, it actually makes it so that we can get a lot of relief throughout this area. What we're going to do now is we're going to take him down to completely flat, 180 degrees, and see how he responds when we go through our flexion test and how his pain response is. In this plane of motion, and when we take him off the couch. We've now got you in full flexion. How is your back in this position? You okay?
Yeah.
Yeah?
Sure.
Could you imagine if we tried to do this at the beginning? Imagine if we tried to do this at the beginning with all the strain and all the tension that you had. It would have been difficult, right? Keep breathing, bro. This is the last bit. What we're doing now is we're doing the heavier pressures into those QL areas. Deep breath in. Straighten this leg and out. Good job, man. Almost done. Deep breath in and out. Out. Good job, man. All the air out. Good. Now just feeling the stretching. Here, yeah. Good. Feel the stretching. Good job, man. Finish. I want you to try two things, bro. Before we go down and touch the toes again, I want you to first try sitting and touching, yeah? And this is one of the movements that I'm going to give to you for your aftercare anyway, to handle weight, opening up the hips, and strengthening the lower back, yeah? So, number one, if you reach down and touch the floor, you'll see how that is, and you can slowly walk down a little bit further, and then we'll see how we are from there, yeah? Go ahead. How are you? Okay?
Yeah.
Good?
Yeah, I'm good.
Perfect. Slowly back up. Good. And stand up. Stand up. That's it. Good job. And now, with the hands towards the feet here. Good job. That's it. Good. Fantastic, my bro. You're touching the toes now, yeah? We can see there is a little bit, we can see here there's a lot more flexion through here, yeah? So we are now coming into this position a lot easier because we've relaxed a lot of these muscles up here. We have got your range of movement back, and you are now moving a lot better. We want to keep that over the long term, yeah? Alright? Pleasure.
Bro.